Hear the latest reporting and analysis on the big stories of the day on the Daybreak Insider podcast. It's top-notch reporting from SRN News, along with the sharpest insight from Hugh Hewitt, Mike Gallagher, Dennis Prager, Sebastian Gorka, and the voices of townhall.com. The Daybreak Insider podcast. It's your first look at today's top stories. Available at Apple Podcasts, Spotify, Google, and at SalemPodcastNetwork.com.
Tired of dealing with vein disease? Have your symptoms gotten worse?
Oh, these spider veins are ugly.
My legs and ankles are always swollen.
My legs are tired of standing all day.
While some symptoms can be managed by lifestyle changes, other factors are out of your control. Get help from the experts at Vein Clinics of Hawaii. To learn more about your treatment options, call 427-5565 or visit veinclinicsofhawaii.com. Aloha, Hawaii! It's time for the Vein Clinics of Hawaii radio show. Their team's approach to diagnosing problems and developing solutions and treatment plans are beyond compare. So let's get started with your host of the show, Mike Buck, and Medical Director, Dr. Randall Juleff of the Vein Clinics of Hawaii.
Well, there you are. I knew you were out there somewhere. Thank you so much for joining us. If this is your first time, welcome. Dr. Randall Juleff, Medical Director of Vein Clinics of Hawaii, and I have been doing this radio show. We've done a couple, it seems like 2,000 of them, but we're heading towards our 150th right around the corner. We want to wish you a good day. And one of the things that I learned about, now, first of all, not only do I host the program, but I'm a patient. And I'm not that patient of a person. So I've had to learn that, and I've learned an awful lot from Dr. Juleff in the last year and a half we've been doing this, and going on for 2 years. I mean, this has just been fantastic. And you know that everybody has veins and arteries, but what are they all for, and do they work together? Do they work against each other? Well, I was so happy to hear, Doc, that today's program was going to be talking about arterial insufficiency. And when we say insufficiency, we mean things aren't working sufficiently. They're insufficient. So today we're going to do both arterial and venous insufficiency. Big difference, huh?
Yeah.
I mean, it's a swing of the pendulum. Basically, what's the difference? Do some defining for us.
Yeah, and I wanted to talk about this a little bit because, we spent a lot of time talking about venous insufficiency in this show, and which is good because, I mean, that's what we do all day long, take care of venous insufficiency. But I think there's some confusion out there with respect to arteries and veins, and I hear it all the time. People have a general idea about blood vessels, and they know that it has to do with blood flow and, blood going in one direction or another. But often, this is just because people haven't, learned it, or they don't remember their, biology class in high school. But arteries are carrying blood one way, and veins are carrying blood the other way. Mm-hmm. And again, people tend to confuse those terms. So I thought we would talk about that and kind of clear up some of the misconceptions about the different types of blood vessels, but also talk a little bit more specifically about arterial insufficiency because that can be a very bad problem too.
Yeah, and that I've learned. And I mean, first of all, knock on wood, I haven't had any of that yet. I've been having a lot of vein problems, but not artery problems. But and sooner down the road in the program, I'm going to ask you, what are some of the things that even cause problems in the arteries? Because one thing I do know, gang, Doc just explained it. The heart has this wonderful pump, and all the blood that it works on goes through that heart and goes in your arteries to where it's going to go to work.
Right.
And it comes back there via the veins.
Exactly.
That's the extent of my medical knowledge.
Yeah. Well, that's good. I mean, that's a start, and that's the bottom line. But so anyway, venous insufficiency. Let's just define that because, like you said, insufficiency just implies that whatever it is that we're talking about is not functioning the way that it should. So and we talk about venous insufficiency all the time. Well, what is venous insufficiency? What does that mean? Veins, like you just said, veins are the blood vessels that carry blood back up to the heart. And the veins in the legs are sort of special because they see the most amount of downward pressure because humans spend most of their life standing up. The greatest amount of hydrostatic pressure within the venous system is in the lower leg and feet. And the other thing about veins as opposed to arteries is that, like you mentioned before, the heart pumps blood through arteries. Blood through veins doesn't move because the heart is pumping. The blood comes from the heart, goes out to the entire body, and then it starts its journey back to the heart. Again, especially in the legs, it requires a couple of different mechanisms to keep that blood moving upward. We don't have a heart, but we have something called the calf muscle pump.
A pump,
And what that refers to, and that's just kind of lingo, and basically what it means is that, the calf muscle has something to do with blood flow in the veins. And what's happening is that when the muscles in our lower legs contract, it compresses the veins. And if it's compressing a vein, then the blood within that vein is going to go somewhere. Yeah. So the other component, so that's one component. The other component of blood flow in the legs, in the veins in the legs, is that the veins require these one-way valves. So there's a bunch of one-way valves all over the veins within our legs, and the one-way means that it's allowing blood to go upward and not allowing it to go back down.
In a perfect world.
Yeah, in a perfect world.
Well, we're going to talk about some of the imperfect parts of the world pretty soon.
So that's how blood then consistently moves upwards in the veins, and there are other things actually, and we don't have to go in depth, but there are respiratory things, and there are abdominal there are abdominal pressure things that kind of go into it, but the basic mechanism are those two things: valves and muscle pumps. So
it sounds to me you're going to tell me that they're. As we go on, that's what makes the veins significantly different from the arteries.
Okay. So what is venous insufficiency? Well, venous insufficiency is the failure of one of those two things, and it can actually be either. Most of the time, when we talk about venous insufficiency, and most of the patients that we see in our office have venous insufficiency because of the fact that the valves have failed, and that's usually the genetically predetermined part of why people inherit venous insufficiency is because of the propensity. They're inheriting the propensity of those valves to fail from their parents or grandparents. So the valves fail, and rather than the blood, consistently moving upward, it then starts to settle downward into the leg, and as that blood pools, we use that term pools. Pooling of blood in the lower leg then creates the symptoms that we typically see. And those symptoms are heaviness, fatigue, achiness, throbbing type pain, swelling, and then as things get worse, we see more physical changes like varicose veins and spider veins and changes in the skin. The skin starts to hyperpigment and gets rashy, and then that's kind of the higher levels of venous insufficiency, but that's the crux of it. Blood. So venous insufficiency implies that the blood is not flowing the way it should, and it then results in all of these not only symptoms but physical findings that we typically see.
Yeah, and we're going to get into that later a little bit and talk not only that, but once you've isolated and figured out what these problems are, how do you treat them? How do you make it go away, or get a little bit better? It is a fascinating system, though. I mean, I've learned so much from you during the time we've been doing the show, not only as the host, but as the patient. And a lot of people will experience some of the symptoms that you just mentioned. One guy will be itchy, one guy will be hot, one guy will be throbbing, but they're all the same problem. It's just that we identify the symptoms differently from each other, don't we?
Yeah. Well, yeah. There's semantics, that go into it, but there's also, there are very different symptoms that different people experience from the same process.
Are they likely to have multiple symptoms, like me?
Yeah, most people do. Most people do. But it's not one of the hurdles that we always have to get over is the fact that many of the symptoms of venous insufficiency and arterial insufficiency, for that matter, but venous insufficiency, people don't immediately connect with a vein problem. If they have varicose veins, then that's obvious.
Yeah, because you can see them.
Yeah. So, but if they have just swelling and darkening of the skin and problem healing, their skin at the lower part of the leg, they don't necessarily jump to, that must be a vein problem. So sometimes it takes people a little bit of time to get around to seeing us. But luckily, most of the time they do. Ultimately.
Yeah. And by the way, seeing us is easy. That's where I plug the website. VeinClinicsOfHawaii.com. Dr. Juleff is the medical director, and it's VeinClinicsOfHawaii.com. And they're on 4 islands. We are, we are doing this show from Honolulu, but there's the Big Island, there's Kona, there's Kamuela, and there's also Kauai and Maui and Oahu. So keeps everybody on the bike going as fast as they can between one another, getting everybody happy. But when you talked about that, are there some symptoms that could be either vein or artery?
You mean are there symptoms that may be related to either venous or both? Absolutely.
That's what
there are there's an intersection of symptoms that can be either one or the other. There are symptoms of venous disease that are pretty specific for venous disease. There are symptoms of arterial disease that are pretty specific for that. So, we have to kind of sort that all out. But so that's venous insufficiency. Now, what do we mean by arterial insufficiency? And basically, we mean the same thing, and that is that it's a failure of an artery. Or several arteries to fulfill what their duty is. Basically.
Okay, well, if the veins have valves and the arteries don't, what do the arteries have that cause them they're a problem? They get smaller. They get clogged up.
Yeah, exactly. Basically arteries get clogged up, and we'll talk about that a little bit more. But the heart pumps blood, and the blood, in an ideal world, slides through the arteries without difficulty. The arteries are very different, just anatomically. Just looking at them, during surgery or whatever. Veins tend to be a little larger, for that comparable, vessel, and the wall of the vein is much thinner. The arterial arteries have a fairly muscular kind of wall, and they don't expand or contract anywhere near as much as the veins can. Although they do, there is a neurologic component to blood flow through arteries, and it's our body is regulated in that way. But the veins have a much greater what we call capacitance, and that's basically what's happening when people have venous insufficiency. We talk about the blood not going up. Well, and pooling of blood. Well, it's not that the blood just continues to accumulate in our legs. It's just the veins are sort of acting as a storage compartment for the blood, because there's a great capacity in our veins, and that's then what leads to the symptoms. But arterial insufficiency basically means that there is not enough blood going through a blood vessel, and then it's going to cause a great deal of different symptoms. Again, we'll talk about that also, that are very specific to the part of the body that's not getting enough blood.
Here's another quick. Obviously, there's blood and there's blood. Can the blood itself cause problems in the arteries if it's got bad stuff in it, or if it's bad blood?
Not specifically. Blood can create a problem when it clots inappropriately. But as far as like toxic materials and stuff, well, I take that back. Are there things in our blood that can cause problems with arteries? Yeah,
because I'm guessing that some of the stuff in the blood attaches to the artery somewhere, and then when you get clogged arteries, right?
Sure. Yeah. And we're going to talk about plaquing in a little bit, but the plaquing is due to fat molecules and calcium and that kind of stuff that basically is going through the blood for sure. So we touched on the venous insufficiency, the symptoms of venous insufficiency a little bit before, but achiness, heaviness, fatigue, swelling, muscle cramping, restless leg, and then all the skin changes that we typically see with the more advanced stages of venous insufficiency. But pain pain is something that we see on both sides. You asked, are there some symptoms that can be either arterial or venous? And pain is one of them. But the pain is different. So for instance, the symptom of pain as it relates to arterial insufficiency, especially in the leg, we can develop something that we call claudication. Now, why does that happen? Well, claudication, and let me define claudication. Claudication is pain in the calf muscle when you walk. And why does that happen in arterial disease? Well, in arterial disease, if there is plaquing in the artery, there's not enough blood getting through that artery that may be supplying the muscles of our lower leg. And as you call on the muscle to work more, it's going to require more oxygen and
I feel a sore leg coming on.
and greater blood flow. And if that artery is not able to supply that increased amount of blood flow and oxygen, then it yells out at you. And so typically people will, walk for a little while, and they develop either a throbby kind of pain or a crampy kind of pain in their calf muscle, and it can actually get to the point where they have to stop.
I was going to say, many people would say that somebody will say, when a husband and wife take their walk, say, "Can we stop for a minute here?
Yeah,
I need to rest a minute here."
Right,
and that's always part of that, isn't it?
And that's what happens. So then, and this is the typical scenario for claudication. You get the pain, you sit down, and then as you rest, the pain goes away, because what's happening? Well, your muscle is resting; it's not needing as much oxygen, and then at some point, then the artery is able to get enough blood and oxygen to that muscle so that it is functioning okay, and the pain stops. Again, that's classic claudication. It has to do with a lack of blood flow going to the lower leg, the calf muscle, and so that's an example of pain that happens with arterial problems, as opposed to pain that happens with venous. Which pain that happens with venous is a little more, throbby, a little more, constant, throughout the day. The typical symptoms of venous insufficiency are things that kind of worsen throughout the day as you're spending more time on your feet and as more, blood is starting to pool in the lower leg. Whereas arterial is a little more sudden, and it can go away fairly quickly. So another symptom is that the skin of the feet can become pale. And we see that. I mean, we see people, in the office when we're evaluating them for arterial insufficiency. During our examination, we see that their feet are actually pale. The skin of the feet and the lower legs can start to lose their hair. And that's a sign of chronic arterial insufficiency. The skin basically not getting enough of blood and oxygen. The skin can become shiny in appearance, and typically what's happening there is that the skin is starting to thin out, again from the lack of blood flow, so you get that very, that's kind of the classic appearance of chronic arterial insufficiency is thin, shiny skin with a loss of hair, and the skin appears pale. the feet can be cool to the touch. And by that I mean, a lot of people will come in and have completely normal blood flow. But they complain of their feet being cold.
Yeah, cold. I've heard that. Yeah,
and,
in your office.
Yeah, right. Yeah, exactly. And so I think that people come in, especially if they're concerned about whether they have vascular problems with their legs. One of their complaints will be, well, gee, my feet just always feel cold. Well, there's a difference between feet feeling cold to the person as opposed to the feet feeling cold to the person who's examining them.
Of course. Yeah, that's a great point.
And
I never thought of it. I just now thought about that.
Yeah.
Very true. Because there's somebody in our office that needs to have the room heated because she just gets really, really cold.
Yeah.
And so that can be a sign of that. She wondered. I said, you got to go see the doc, find out.
Yeah. Well, that often in that situation, often it has more to do with not the fact that they have arterial insufficiency, but the blood vessels can be very reactive. They can contract and expand, et cetera. So when you go into a cold environment, some people have sort of an enhanced or overreaction of constriction of the blood vessels. And there's reasons why that happens. But, when it does happen, they can feel like their feet are cold. And in that instance, actually, their feet do, when you touch them, they feel cold. But so that's a little different problem, but also has a, physiologic cause for it. The legs and the feet can become numb. Weakness in the extremity is also a sign of arterial insufficiency. We see numbness sometimes in venous insufficiency. It's not as hard of a symptom as it is in arterial disease. But very often people will complain of numbness of the feet and lower leg, and they ask me about that. And basically, is it going to improve when we fix their venous insufficiency? And it's not all the time, but sometimes it does. I just make sure that they know that it's not necessarily going to happen, but because there are other reasons for that. But sometimes,
by the way, these are two systems that meet each other in your feet.
Yeah.
Right.
And
it gets very tiny, some of these things in your feet, aren't they? Some of the veins and arteries. They're tiny little things.
Absolutely. Yeah, they become very, very small. Yeah. Erectile dysfunction in men can be a symptom of arterial insufficiency, lack of blood flow. And then we have this thing that this is kind of on the spectrum of pain, but there's one situation of of pain that occurs with arterial insufficiency. We call it rest pain, and that means that the person doesn't even have to be exercising their leg to have pain in that foot or that lower leg because of lack of blood flow. So obviously. When we talk about somebody having rest pain, that's kind of a serious sort of symptom that needs to be evaluated and addressed probably very quickly. Some people will even, one of the classic stories is that the patient comes in and says, "Gee, when I go to bed at night." When I lay down flat in bed, I have pain in a foot or a lower leg, and they actually describe having to hang their leg over the edge of the bed in order to enhance blood flow down. Just that little amount of increased pressure. So again. That indicates a very critical level of arterial insufficiency and usually inspires people to be evaluated and treated pretty promptly.
Yeah, by the way, all of these symptoms can mean different things. And by process of elimination, that's what Dr. Juleff's office will do. So if you go to veinclinicsofhawaii.com and check out a lot of the different shows that we have there. And then there's another thing, and it's pretty involved when you decide to become a patient and you go down and get evaluated or get diagnosed. You have now, I think, I call it the dreaded iPad, because there's a lot of questions, a lot of things, but they all help, don't they?
Oh, yeah.
And that's why I said many people have one symptom and for one guy it's tingling and the other guy it's burning, but it's the same problem. We perceive them as different. Yeah.
Right. Yeah, a lot of people complain about the iPad because
I love it.
There's a lot
Makes it easy.
Yeah, there's a lot of questions there, but it helps. I mean, it really helps paint the picture. And even though it seems like a lot, it's really very helpful for our medical records. So what are the risk factors for arterial insufficiency? I mean, we've talked about venous insufficiency a lot, but what are the risk factors for arterial disease? First and foremost is smoking. I think everybody knows, by now that smoking is not good for a whole number of reasons, but especially for arterial disease, and can lead to heart attack and stroke, et cetera. But also just peripheral arterial disease in general. Diabetes, and especially diabetes that's not controlled well, is a very strong risk factor for developing arterial disease.
There are tens of thousands of type 2 diabetics that are not even aware that they are diabetic. Mm-hmm. And isn't that interesting when they all of a sudden go to a doc and the doc says, hey, you know what, we need to test your blood sugar. Mm-hmm. Whoops, yeah. What do you mean? I got no problem.
Yeah. Yeah, there's that situation, and then there's a situation of people that they know they have a problem with blood sugar control, but they're reluctant to have it treated for some reason. And it's like high blood pressure. Not treating diabetes, not treating high blood pressure is just it's a terrible thing not to do
idea.
Because they, especially blood pressure, they don't call it the silent killer for nothing. You go on years and for long periods of time, and if those two things, high blood pressure and diabetes, are not controlled adequately, it can lead to very bad problems, especially arterial problems. Obesity is another one, of course. Obesity is a risk factor for both arterial and venous. But high cholesterol, I think most people know that. High blood pressure can lead to arterial insufficiency and increased amount of arterial disease. Age over 60, so we both have that as a risk factor, Mike. Yeah. I'm sorry to have to say that.
I'm in the group.
Yeah, I'm in that group too. Male gender, we're both in that group too. Sedentary lifestyle.
Sometimes I'm in that group. Nobody wants to be in that group, but it is. And here's the problem: if you have these conditions, venous or arterial problems, they are impacting your ability to move around. And when you don't move around, you start deteriorating. Mm-hmm. Movement is important every day.
Yeah. Activity is good at all ages, for sure. Then family history of arterial disease, heart attack, or stroke. If you have that in your parents or grandparents, that's something that you need to know about. I mean, my father had arterial disease, so this is something that I have that I always think about. And because it is, genetically, occurs, and so if you have those genetics, you need to be thinking about other things that you can do to sort of minimize your risks otherwise. There's something called homocysteine, and it's something that we measure in most people's blood work, especially if we think that they have arterial disease or want to try to alter their risk factors. And we have just found that homocysteine is kind of a marker for arterial disease. So many people might see that in their blood work. Their doctor may be, ordering that specific thing to kind of give him or her an idea about their risk for vascular disease. So, what is the incidence of arterial disease? Cardiovascular disease is the leading cause of death, not only in this country but globally. So, it's a tremendous source of morbidity and mortality, throughout the entire world. It is the cause number in one or another of 50% of the deaths in Western countries. So cardiovascular disease,
right up there, couldn't be higher.
Leads to death, more often than not. In the U.S., one person dies every 36 seconds from cardiovascular disease. That's a lot of people.
That's a lot of people.
You
know what I mean? When you take a look at people now, where everybody's looking at the pandemic and all of these things, you take a look at some of these other numbers, they're pretty scary as well.
Right.
How many in a year?
Yeah, in a year, 600,000 people die from heart disease in this country. Yeah, so, a lot of people. Heart disease, one form of atherosclerosis, is responsible for 1 out of 4 deaths in this country.
Wow.
So,
big number.
Yeah, impacts a lot of people. Stroke, which is another form of atherosclerosis, is the 5th leading cause of death in the U.S. So, again, it's very, very common. And, again, if you have to, we talk about the risk factors because it's beneficial for people to kind of assess their own, risk level. And maybe they can do that in conjunction with their physician. Maybe their physician can kind of help them assess their risk, and then take steps appropriately to try to lessen the risk. I mean, obviously, not smoking is one of the most obvious things not to do, but there are other things that can be also kind of set into your day-to-day kind of lifestyle that's going to be beneficial.
Yeah, I think that most people, not most people, I already know it. Almost everybody's getting over smoking. I mean, it is way backed off. But and I see there's this big push now to get these kids to stop vaping.
Right.
Because we don't know about that either. But but it is one of the more difficult things to control, isn't it? I mean, people. I used to smoke, and it was not only was it a terrible habit, but I quit a lot of times. It's easy to quit, but everybody starts back up again. But I think now, when you get, especially if the doctor says one thing you need to do is stop smoking.
Yeah,
more people are paying attention to that.
I think as time goes on, I mean, it's when you think about how the world was, 20, 25 years ago, where just about everywhere you went, you saw a smoker.
Always.
And now it's very, very rare. So it's a good thing. And absolutely nobody should be smoking anymore. We certainly have plenty of evidence to know that it's bad for everybody. But then we talk about not only the incidence, but also what is the cost? What is the dollar cost of treating people? And for instance, in 2016 in the U.S., we spent $555 billion treating cardiovascular disease.
Brother.
So that's that's a lot of healthcare dollars that go into treating one little section of health issues that we have in this country, and the number of dollars that we're spending is expected to double by the year 2035. So 15 years from now, we're going to be spending twice that. So why does blood flow start to lessen in arterial insufficiency? And we sort of alluded to this before, but basically, something occurs that we call atherosclerosis, and atherosclerosis, another term that people often have used, especially in the past, is hardening of the arteries. And it really the artery does really harden because of atherosclerotic changes, but primarily it's an inflammatory process that ultimately leads to, as you mentioned before, plaque formation. And plaquing is just a buildup or a thickening of the wall of the artery at various sites, and that plaque accumulation typically occurs commonly occurs in specific sites. So in people, I mean, across the board, and we'll talk a little bit more about that in a bit. But what is the plaque formation? What is that made of? And we talked about it a little bit. It's a buildup of fat and cholesterol, calcium, fibrin, which is a protein that is circulating in the blood, and there's an inflammatory kind of milieu that allows for those molecules to kind of enter the inner lining of the artery and then builds up in that area and causes the thickening. And as the plaque gets larger and larger or thicker and thicker, it's limiting more and more of the flow through that part of the artery.
Eventually, from what I understand, it'll just get closed off.
It can.
It can.
For sure, it can. So often this happens at specific sites, like I mentioned, within the bloodstream, and often it's at points of branching, or if there's a branching point in an artery, and one very common site for that is the carotid artery, which is the artery that goes through the neck. And there's one specific branching point within the carotid artery where one branch goes up into the brain and the other one goes to more of the musculature of the face. But at that branch point, it's a very, very common site for plaque to build up, and that's the area that can lead then to stroke, because the either the blood flow diminishes to the point, or more often what happens is that a part of that plaque breaks off, goes up into the circulation of the head, and that's what causes the stroke. So again, plaque forms in those specific areas. Usually it's not, it's not a great mystery as to where that's going to happen. But plaque formation can start actually in teenage years. When we do autopsy studies on people who die at early ages, we see that there's a fair number of those people that actually start to see plaque formation in their arteries that only gets worse with time, kind of like venous disease.
Yeah, it sounds like venous disease to me.
Starts at an early age and comes on very slowly, but often, or unlike venous disease, in arterial disease, the symptoms can often occur very suddenly. So, I mean, the plaquing starts and the blood flow starts to diminish, but often it's kind of a sudden event that then leads to a problem because of lack of blood flow. And usually that starts from a little defect in the lining of the artery. And that's the sort of the entrance site of where these molecules build up. Once the plaque gets to about 70% narrowing of the artery, that's kind of the general rule of thumb, that when it reaches about a 70% narrowing, that's when it's going to start to inhibit a significant amount of blood and oxygen getting to whatever body part that it's going to, for it to become symptomatic. So, when we talk about claudication, for instance, in the leg, usually that's associated with a plaque somewhere in the arteries going down into the leg. And typically, it's going to be in in an area where there is a plaque, where there's at least 70% narrowing.
Wow!
Now, usually when we see these, when we evaluate patients, they've gone far beyond that 70%. But 70% is kind of like the minimal amount that you need to, really inhibit blood flow and inhibit oxygen delivery.
Yeah, let me ask you this, because we often talk about, we always talk about veins, and I'm imagining that there are some treatments that we're going to talk about, time permitting, on arterial, conditions. Is that something commonly that you see in your office? I mean, when you're doing treatment of my veins, are we also looking at my arteries?
We do if we feel like we need to.
Yeah, that's what I'm thinking.
So, we do have plenty of people that come in and we're not sure, or they sound like they have more arterial symptoms than they do venous. We certainly see
it's
those
an easy
people.
mistake, isn't it?
For For sure.
Yeah, I think I got this, or I think I got that.
Definitely. And even for referring physicians, we often are referred people The doctor will call and say, well, I'm not sure exactly, what's going on with this person. I believe it's vascular, but I'm having a hard time sorting out the symptoms. And yeah, we see those patients all the time. We definitely help primary care providers, figure out exactly what's going on with their patient from a vascular standpoint.
Yeah.
And, if it's venous, we fix it. If it's arterial, we don't do that kind of work anymore, but we get them to, physicians that will fix that for them. So, when we have a lack of blood flow and a lack of oxygen getting to a part of the body, we refer to that incident as ischemia. Ischemia means that there's not enough oxygen getting to, again, the muscle of the calf or wherever. And the ultimate symptoms of lack of blood flow, like I alluded to a little earlier, has to do with the end organ that we're talking about. So if it's the leg, again, it's claudication, but initially, early on, it's claudication. But as that process gets worse and worse, lack of blood flow obviously is going to lead to chronic ulceration. We can see chronic ulceration in venous disease. We also see it all the time in arterial disease because of a lack of blood flow getting down to the foot.
Do you ever see those on the outside, or that's strictly inside?
The ulcers are outside, are on the skin somewhere. Now,
okay, so I could have an ulcer, and it could be either a venous ulcer or an arterial ulcer.
It can be.
Wow.
Yeah. But they
I don't want one of those.
Either one. Yeah. But they look very differently. Usually the appearance of the ulcer that comes along with arterial insufficiency doesn't look anything like venous ulceration. So and it's pretty easy to spot. I mean, venous ulcers tend to be more around the ankles and the lower leg. They tend to be, fairly large at times, and the base of the ulcer has a specific appearance, as opposed to arterial. The ulcers that we see with arterial insufficiency, that are more they're more kind of at the end of the line sort of thing. Either the tips of the toes or the lower part of the foot, the foot may be pale. May lack hair and have all those other signs, and arterial ulcers tend to be a little smaller, a little more punched out, and again, they all have a pretty typical appearance. So it's usually not a real mystery. But if we're talking about lack of blood flow to the brain, that's going to cause a stroke. If we're talking about lack of blood flow to the heart, it's going to lead to a heart attack. Pain in the extremities. Another condition can be a lack of blood flow to the GI tract, and that's going to give a certain set of symptoms and problems. So it's related to the end organ, but it's all the same process. It's the same process of atherosclerosis and plaquing within arteries, but it's going to lead to a lack of blood flow, and it's going to affect the end organ in a way that's specific to that organ. So, if somebody has a lack of blood flow to the heart, they're going to have chest pain, they're going to have shortness of breath, they can have weakness or dizziness. Sometimes people will present with nausea and sweating. Sometimes the first symptom of a lack of blood flow to the heart could be, a full-blown heart attack, myocardial infarction. So, we don't want it to get to that point, and that's why we try to educate people about the symptoms of lack of blood flow to their heart, which often is chest pain. But chest pain and shortness of breath are probably the two most common ones.
And I'm glad, by the way, gang, that we have an opportunity to learn about this stuff, because we don't talk about the arterial system all that often, because that's not the field in which Doc is operating on. But it is good to know that you can get diagnosed and a treatment plan can get developed. And you want to check it out at veinclinicsofhawaii.com. That's veinclinicsofhawaii.com. And remember, Dr. Juleff is the medical director, and you can get an examination scheduled and start having peace of mind in a relatively quick period of time, like I did.
Yeah. Exactly.
Yeah.
So I think the main point here is, if people tend to ignore symptoms, and you don't want to ignore some symptoms. Chest pain is one of those things. Chest pain and shortness of breath. Yeah. You don't want to, if you're starting to have those kind of symptoms especially during activity that you didn't have before, then that can be a sign that there's something going on, and you need to have evaluation. Lack of blood flow getting to the brain can also have those kind of, minimal sort of symptoms that are signs. For instance, there's something called amaurosis. And that has to do with a sudden loss of vision in one eye or the other. That's a symptom that should not in any way, shape, or form be ignored, because that is something that can be a sign of arterial plaquing in the carotid arteries that could lead to a stroke. This amaurosis that we talk about is that has to do with the fact that a plaque has formed in the carotid artery, the blood the blood vessel that leads up to the brain, and the surface of the plaque may have become friable, and often a little piece of plaque or calcium can break off from that plaque and go up into the brain. Well, the circulation to the eye is part of that. If that little piece of plaque then goes into the artery that is supplying the eye with blood, then people can have a sudden loss of vision that might come back. Typically it does in this situation where you might have, we talk about a shade coming down over your eye. That's kind of how it's described. If it may last just a few minutes or a couple hours or whatever, and then it goes away. Well, people think that was nothing. That happened, and everything's fine because it went away. But it's a sign of very potential. I was going to say it may have went away, but hey, it got there. Yeah, so, and it got there for a reason. Yeah. So. Those are the kind of things that you don't want to ignore. Sudden weakness or numbness on one side of the body or the other is also one of those signs that can be caused by a blockage of arterial blood flow to the brain, slurred speech, dizziness, those types of things. And again, the symptoms may last just a short period of time. But even though they have gone away, you need to listen to those kind of symptoms. And then in the extremities, obviously, we've talked about claudication, which is, muscle pain when we walk, difficulty healing wounds. That's another thing. That's another one that kind of is applicable to either arterial or venous insufficiency. Chronic ulcers, again, the same thing. So anyway, making the diagnosis, how do we do that? And again, that's a little dependent on what part of the body we're concerned about. If somebody comes in and they're talking about chest pain, shortness of breath, then we're going, okay, this patient may have a heart problem. So we do things like stress testing, echocardiography. CT scanning also can evaluate, atherosclerotic changes within the arteries that go to the heart, coronary arteries. And then, of course, if we are very concerned about the coronary arteries, then we do left heart catheterization, which is basically just an angiogram. We inject dye into the arteries going to the heart, and we can see exactly what's going on. And then often act upon that finding, right then and there. But for the brain, if people have, ischemic symptoms related to the brain circulation, the first thing we do, again, there is an ultrasound. And ultrasound often will show us, the problem if there is plaquing within the carotid artery. but we also do CT scanning and also angiography in that situation, and determine what should be done. Extremities also ultrasound, CT scanning, angiography. We as these modalities, as these radiographic modalities become better and better as time goes on. It's amazing, what we can see. With ultrasound, we talk about ultrasound and the the capabilities that we have with that modality, but CT angiography is also something that is very commonly done these days that we didn't have a number of years ago, and is a little safer and a little easier on the patient than doing a formal angiogram.
Yeah, and that's often why, gang, I keep reminding you that the old gray mare ain't what she used to be. The diagnosis and the equipment and the treatment have so improved that any frightened feeling that you've had of seeing elders or loved ones go through some really tough times getting treatment, those days are pretty much gone.
Yeah. So what is the treatment? What are the things that we should be doing to, really minimize our risk more than anything? There's a variety of lifestyle changes that we need to consider. And, of course, first, eating a very heart-healthy kind of diet. Low in fats, although, as we are learning more and more about dietary things, we're not focusing as much on fat as we used to. But I think in general, a low-fat diet is still, a good thing to do. But as importantly as that is, low carbohydrate. I mean, one of the problems with the American diet is, eating simple sugars. I think that, one of the things that we're, focusing more and more on these days is, carbohydrate metabolism and, how restricting simple sugars from our diet is, as important as eating a low-fat diet. But a diet rich in vegetables and fruits and all those things that we all know are healthy, those are good things to do. But so maintaining a good, healthy diet, maintaining a healthy body weight, again, very, very important. Not smoking, as we've talked about, exercising regularly. And you don't have to go to the gym 5 days a week. I mean, even taking 30 or 45 minutes of doing some strenuous kind of activity, commensurate with your physical capabilities and age, and just like you alluded to before, staying active. That goes
walk
into,
before you can run, but do something. Don't just sit there because if you don't change, it won't.
It'll
get worse.
And, managing stress, I think, is probably good for a generally good, healthy lifestyle. And again, getting back to blood pressure, I mean, keeping blood pressure and blood sugars controlled. If you have high blood pressure, then by all means, don't avoid being treated. Don't avoid taking the medication. We see so many people who don't, for whatever reason, want to take medication. And, I understand limiting the amount of medication that you take, but, medication that is directed to high blood pressure and, blood sugar control are so very important. Both of those things have to be controlled. Otherwise, you'll run into many, many health problems as the years go by. And there are medications that we talk about: blood pressure, cholesterol. Aspirin. Although for many years a daily aspirin was felt to be, beneficial, especially for people with cardiovascular disease, but. I think there's been some question about
I was going to say that's been changed around a little bit lately.
Yeah, that's been changed, and I think that the risk we're finding that the risk of bleeding even with an aspirin may not be worth the benefit that you're getting. So, and interventionally, I mean, there's all sorts of things that we do these days: balloon angioplasty, stenting, bypass surgery. all of that stuff that we can do, and we're doing more and more minimally invasively too. I mean, 20 years ago, all of these vascular problems were handled with surgery and bypass in one way or the other, but we're doing so much more in the cath lab these days, and it's becoming much more easy on the patient, and the durability of the procedures we're finding are very good.
Terrific. And gang, listen, that's just the tip of the iceberg, so to speak, but I hope you got a better picture today, and if you want to know more, you go to veinclinicsofhawaii.com. That's veinclinicsofhawaii.com. And, I'm telling you, these little steps that you take are going to save your life, and this is the year to do that, A lot of stress going around with the pandemic and everything else. Get yourself squared away at veinclinicsofhawaii.com. Once again, that's veinclinicsofhawaii.com. For Dr. Juleff and everybody else at Vein Clinics of Hawaii, I'm Mike Buck. Thanks for being with us. See you next time.
Well, that's our program for today, and we certainly hope you enjoyed meeting us. Please come back next week for our next episode. And in the meanwhile, to learn more, please visit our interactive website, veinclinicsofhawaii.com. That's veinclinicsofhawaii.com.